Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
I am Dr. Amanda Williams, and wow, there's so many wonderful nutrients that I can go on and on about when it comes to detoxification, but I will hold off on that because right now, as I have been telling all of you this week, that I have the distinct honor and privilege of talking to one of the world-renowned top vitamin D experts. And for me, this is so important because I've been in this field for so long. And I actually remember reading an article by Dr. Matthews many years ago. And I was so inspired by it because as you have listened to me on the radio, you know, vitamin D is kind of my go-to nutrient. So to have the ability to talk to Dr. Matthews, who has just recently retired from being a trauma surgeon and critical care surgeon, he is just a wealth of knowledge on vitamin D. And so we are going to talk about this today. Just to give you a little bit of a background, he is so well regarded in the medical community. He was on faculty at Morehouse School of Medicine and a trauma surgeon over at Grady Memorial Hospital for many years. He did his fellowship in trauma and critical care up at Mayo Clinic. So it is such an honor, and he has just so many awards and accolades. And so it's just my privilege to welcome Dr. Leslie Matthews to the show today. How are you, Dr. Matthews?
Oh, I'm doing great, Amanda. Thanks for having me on your show.
Oh, I'm so happy. I read an article that you did many years ago talking about vitamin D, and I thought, oh my gosh, hallelujah, we have a surgeon that is paying attention to the importance of vitamin D. And I found it so intriguing that not only did you really zero in on, the difference between obviously acute inflammation and chronic inflammation and seeing that in different settings within the critical care environment, but recognizing how many patients present with vitamin D deficiency and then how you have expanded that out and really got into the athletic end of that. So maybe you can tell me just a little bit about the surgical experience and how you got so involved in vitamin D so many years ago.
Well, I remember back in medical school, we had a professor doing a lecture that stated that if you eat 3 healthy meals a day, that's all you needed to do. And so I knew at that point that you can't eat 3 healthy meals a day because vitamin D, you only get 10% of vitamin D from your diet. So you get 90% of vitamin D from the sun. And society has changed. Back 50 years ago, we used to be an agricultural society where people hunted, fished, kids played outdoors. Now we're a technological society where everybody's on a computer. Very few people get enough sunlight. So vitamin D deficiency is more common than the coronavirus pandemic. So vitamin D deficiency is a pandemic within itself. Half of the world's population is vitamin D deficient due to air conditioning, sunscreen, and our other modern lifestyles.
And that is so true. And I talk about this, and I actually was just talking about the study with the New York Giants and how when they tested out the serum vitamin D levels of the Giants players many years ago, that they found that over 80% of the players were in an insufficient status. And so it kind of drives back to that point that you recognized so many years ago in saying, hey, there needs to be a primary focus. And I know that in your time at Grady and at other hospital systems that you were really trying to stress this point to other physicians in the hospital, saying, hey, we need to be testing serum vitamin D, and even working with the nutritionist and saying, let's look at vitamin D levels, because if we can make these corrections in vitamin D, we can really start to provide much better care. So yeah, when it comes to the athletics, I know that you have been very much so involved, even with those roll tides down there in Alabama. So when it comes to athletics, do you think that there is enough emphasis on this? Because there's been so many studies now that have shown and impressed upon that even with heel time, with injuries, that vitamin D is so critical. Are you starting to see that we're starting to make a little headway when it comes to the athletic arena?
Well, we are not making enough headway fast enough. Some of the coaches have embraced it, and others have not embraced the science. Nick Saban and Kirby Smart are very smart, very intelligent men, so they embraced it right away. And I remember the first question Coach Nick Saban asked me, or asked his nutritionist and his head trainer, what was his vitamin D level? So that's why he's a winner, has won 7 national titles, and Kirby Smart has won 1. They've embraced it faster than other coaches have. So coaches are not embracing it as fast as they should. And it actually makes a big difference in athletic performance, injuries, concussions, sprains, strains. And like you said earlier, over 80% of the New York Giants football players were vitamin D deficient. Same thing in hockey, basketball, and other sports also.
Yeah, and it blows my mind because I've been doing this for many years now, and I actually was up there in your area for some time. I did my third and fourth year of medical school. I was in Atlanta, and I did predominantly I was over at Crawford Long, but I actually had one elective rotation over at Grady where I was doing nephrology, and I reflect back on this now. I must tell you, Dr. Matthews, and I think, did we even put any emphasis on really assessing vitamin D levels in the nephrology clinic? And I can't recall that. And I think, how off are we in the traditional training of doctors that we just really don't put any emphasis on vitamin D other than it's good for your bones, when technically we know that vitamin D is a hormone. So maybe you can kind of explain that to us a bit.
Okay, there's a big difference between a hormone and a vitamin. When they discovered vitamin D 100 years ago, they had vitamin A, vitamin B, and vitamin C. So the next substance, they just named it vitamin D, not knowing that it was a hormone. A vitamin is like a spark plug. It just makes chemical reactions go at a lower temperature. So when you eat, your body stays at 98.6 degrees. It doesn't rise up to 120 degrees. A hormone works in your blood, and it works in multiple different places, just like testosterone, for instance, on a young male. When testosterone is produced, it affects the voice, it affects facial hairs, it affects fertility, and it affects muscle development. So there are receptors for vitamin D on every cell and tissue in your body. So that makes it a hormone. It has multiple effects besides just making your bones strong.
And this is so true. And this is one of the areas that I impress upon our listeners all the time is, hey, you need to get that serum vitamin D level assessed every year because, as you were even mentioning, oftentimes people they say to me, Amanda, I get enough sun, so I'm sure my vitamin D level is fine. And I kind of go back to what you were saying. Well, vitamin D isn't necessarily absorbed that easily, especially in the setting if someone has a magnesium deficiency on top of that. So when you look at all of the different factors to how vitamin D absorption can be impeded and how many folks, like you said, are walking around either deficient or completely insufficient, and then you look at all of the different chronic diseases that you can start to tie into that, it's a major problem. And so it's, for me, being able to speak with you on this, because I know that you have such a vast background and knowledge of this. Now, when it came to your practice, did you find that in the setting of critical care treatment, that once you started to zero in on the vitamin D levels being so low and you started to make those corrections, what type of results were you seeing in those critical care environments?
That's a very good question, Amanda. We lowered our incidence of ventilated-associated pneumonia from 80% down to 20%.
Wow.
And that was significant. We lowered our mortality rate overall for trauma services from 11% down to 3-4%. And we cut our hospital days about 3 or 4 days. We cut ICU days about 3 or 4 days. And we had fewer readmissions once our trauma patients were discharged. We had fewer falls on the service, fewer bed sores. We cut our heart attacks and stroke rate in half. And so it affected everything. And we went 12 years without a single lawsuit. Were my residents perfect? No. Patients were getting out of hospital 3 or 4 days faster. Prior to my arrival at Morehouse, they had over $30 million in malpractice claims against the school. So for 12 years, we had zero malpractice. Usually every 3,000 or 4,000 patients, you have a malpractice lawsuit. We went over 20,000 patients without a single lawsuit in a 12-year period. So it lowers your hospital costs, lowers malpractice insurance, and so actually using vitamin D on all my trauma patients was saving the hospital money, really.
Oh my gosh. Is that not amazing? And I mean, the two of us, can understand that, functionally as to what's going on in the body. But I think for some of our folks listening to really understand that something as simple and really cheap as vitamin D is, that how much of an impact that actually made. Now, I know that you had mentioned COVID, and I know that you were kind of at the forefront of that when the pandemic started, is kind of being the guy out there with your bullhorn saying, hey, let's focus on some vitamin D levels. I remember seeing the initial studies coming out of Italy where they were showing that serum vitamin D levels being low in the northern part of Italy and the severity of COVID infections in that part of the country versus southern Italy. So did you find that your voice was being heard basically at the start of the pandemic when it came to, hey, we really need to zero in on vitamin D?
Well, I think they thought it too good to be true. It's kind of like Einstein summed up all the energy in the universe, E equals MC squared, where previous scientists had about 30 chalkboards of calculus and statistical equations. And but it actually works. Like I said, it's a hormone. So one of the things that vitamin D does, it enhances your innate and your adaptive immune system. It increase your antimicrobial protein levels, which fight off any type of infections. So it works against all infections. So with ventilator-associated pneumonia, we had bacterial pneumonia, viral pneumonia, fungal pneumonias, and it worked on all of them equally the same. It didn't matter what type of pneumonia. With the antibiotics plus the vitamin D high doses, all of our patients, like I said, we decreased the incidence from 80% down to 20%. There was all comers, all different types of pneumonias.
Wow. And that's just remarkable. And, it's one of those things where I often talk to folks, and I can't tell you how many younger people have come to me, and maybe they're soccer players, or they have they're playing football, and they don't take any vitamin D, and I'm like, oh my goodness, we need to at least know what your vitamin D level is, because it's likely to be low. But if you're playing those types of sports in particular, you need your vitamin D. So what interests me about you is when I read this article that you did many years ago, that you were talking about how you got involved into looking at athletic injuries by going out, I believe it was your nephew's high school. Yeah. So I thought maybe you could tell me a little bit about that.
Yes, I started working with my nephew.
Oh, you know what? Actually, Dr. Matthews, let me have you hold on. They just told me we have to cut to a quick break. So on the flip side of that break, I want to hear the story because I find it so interesting. So we will be right back with Dr. Matthews just after this. I'm Dr. Amanda Williams. You're listening to Invite Health Radio. Welcome back to the Invite Health Wellness Hour. I am Dr. Amanda Williams, and we are taking care of business right now with the world-renowned vitamin D expert, Dr. Matthews. And Dr. Matthews, as I had mentioned, he has so many different awards and honors, and he's been a speaker at so many different events, and he is the go-to when it comes to anything vitamin D, and we're just having a great conversation here. So Dr. Matthews, I want to talk a little bit about your nephew and the football team and how you kind of started to tie all of that together, even when it came to concussions. So if you can tell me how you came upon that idea.
Well, actually, like you mentioned, I started working with my nephew Jordan when he was in 8th grade. He's about the size of Pee Wee Herman at the time.
I love it.
I started working with him. So I placed him on high-dose vitamin D, and actually, this kid was a 3-time Georgia 5A 110-meter high hurdle champion, and as of today, he still has the 3rd fastest time in high school Georgia 110-meter high hurdles. His younger brother was a 2-time 5A champion, high hurdle champion in the state of Georgia. So what the Hormone D does is, people have always said, coaches have always said, the speed you're born with is the speed you have. That is not true, and so I always think outside the box. So one thing that vitamin D does, it increases the number of fast-twitch fibers that you have, and it increases the diameter of these fast-twitch fibers. So you have 2 types of muscle fibers, fast-twitch and slow-twitch. Fast-twitch is what you normally see in the sprinters. The slow-twitch muscle fiber is what you see in distance runners. So if you can increase the number and the diameter of fast-twitch muscle fibers, that person should be able to run faster. So instead of running a 4.7 40-yard dash, they might get down to a 4.6 or 4.5 40-yard dash. So in football, that's very important. So if you have linemen that can run 4.6 40s, they can run a quarterback down from sideline to sideline before he even gets across the line of scrimmage. And also, it increases muscle strength since you're increasing the muscle fibers. So Jordan was a football player and a track athlete. So when he started playing at Martin Luther King High School, the coach was just amazed at how fast and how strong. He was the fastest player on the team, the strongest player on the team. So the head coach at the time, Michael Carson, summoned me. He wanted to meet with me. He asked my niece, "What do you have this boy on? What is he taking?"
Oh, that's great. I love it.
So she told him vitamin D, and so I met with the parents and school officials, and we devised a protocol, a program for the entire football team. So, Martin Luther King High School at the time became a 5A powerhouse. They were one of the most dominant teams in all the state of Georgia. And first year that we started the program, they had 25 players. They got D1 football scholarships off the first team that I work with, and everybody thought that was a fluke. And then the next year they had 24 players.
Oh my goodness!
Scholarship. And so it was proven beyond a shadow of a doubt. And then they had numerous concussions the year before. And then so I was looking at everything, fractures, muscle strains, sprains, and everything. So they went down to 0 concussions a year. We were working with it. And so remember that your skull is a bone. Yeah, your skull is a bone, and just like your arm or leg. So if you look at battering rams, they butt heads all day, and they don't get concussions, and they don't fall out normally. And you look at the woodpecker slams his head into a tree 17,000 times a day, and he doesn't fall off the tree with a concussion or fall out. So the thicker...
I've never thought about it that way. That's amazing.
Yeah. So, Amanda, the thicker your skull becomes, that kinetic energy is transmitted to the bone, and it stops before it gets to the brain or the soft tissue. So making that skull thicker basically protects your brain. And so then even if you do get a concussion, it helps it heal faster because vitamin D is antioxidant, it's anti-inflammatory, and so it works on inflammation and oxidation, which are some of the, we know now that most diseases are caused by chronic inflammation when it goes from acute to chronic. And the average football player, by the time they finish college, they've been hitting it, had at least 7,000 hits to the head or just in practice and games alone. And so it's these subconcussive blows that can cause concussions. So you need about 100 G-forces of energy to the head to cause a concussion. So if you get 80, and 60, 70 consistent over a 10, 12-year period, you're still going to have that chronic inflammation, which produces CTE. And so, I noticed that these players, even with my traumatic brain injury, I have a patent right now. I was awarded one of the first patents. We use vitamin D in our traumatic brain injury patients, and patients that would normally go to a nursing home or a long-term rehab center were waking up and going home. And actually, I had one young lady that had one of the severest head injuries that you can have. Years ago, she graduated from University of Georgia, summa cum laude, and got master's from University of Georgia. And she's married and teaching school now. So and then I'm working with a 15-year. I'm working with a 15-year-old kid right now that had one of the worst head injuries. He had a bleed into the brain stem, from a football hit, and he was airlifted to CHOA. So I got consulted by the mom. She looked my name up, and they expected this kid not to make it. They were talking about pulling the plug. The doctors trying to convince the mom to pull the plug on him, that he would never live, never survive. And this kid is now at home convalescing, so he's communicating. He's back to a GCS of 15, and he's learning to walk again. Just made his first steps, by himself in rehab. So I expect him to make a full recovery too. So it does amazing things. So traumatic brain injury is just the worst of the worst along the continuum. Concussions, mild, moderate, severe, and then the worst traumatic brain injury. So it works in the worst of the worst traumatic brain injury. So people, even with the traumatic brain injuries, we lowered our mortality rate from 11% down to 6.6% with the traumatic brain injuries.
Wow. Now let me ask you this, because I know that, with the CTEs, the encephalopathy and, tying different players who have maybe had some issues, in the past, and we definitely see this being incredibly problematic, and more NFL players coming out and speaking upon this. Do you think that vitamin D has even been looked at in any of these players who are experiencing the encephalopathy?
It has not as much as I wanted to. That's why, I hired an advertising agency to try to get the word out that these players don't have to suffer these devastating injuries. There's help out there that can help. And so, like I said, I actually have a patent on it. You can Google my name and traumatic brain injuries and patent and see that, I was awarded a patent. Normally it takes over 2 years to get a patent. So the U.S. Patent and Trade Office had my patent completed in, 18 months. And they commented on it, said this is a novel and unique treatment for traumatic brain injuries. That was their statement, on my patent.
Oh, well, I am going to stay on top of this. I would love to be able to stay in contact with you, Dr. Matthews, because I am a vitamin D fanatic. I must say, I've been in the nutraceutical world for many years now, and it's one of those things where I just keep trying to tell people, vitamin D it's the key. And so, your background and your extensive knowledge, it's been such an honor for me, I must tell you, to have you on the show today. And I look forward to future conversations. And I really just want to express my gratitude of you taking the time out of your day. I know that you're very busy, and for joining me to talk about this on my show today. So thank you so much for joining.
Well, thank you for having me, Amanda. Have a great day.
All right. You take care now. So what an honor. I tell you, I have been following Dr. Matthews' work for many years now. And with the knowing how many injuries are out there, and there's more awareness when it comes to football injuries, but also recognizing the importance of vitamin D when it comes to our immune system, when it comes to chronic disease states, and having him kind of break that down in terms of the difference between acute inflammation, which in a case for a surgeon, they want to see that acute inflammation. They want the body to be able to heal fast, versus that chronic inflammation. And for those of you who have listened to me for many years on the radio, you know that I'm always going back to that. And I talk about inflammaging and the importance of keeping that chronic inflammation in check. So vitamin D is an integral part to that. So for those of you who are listening, if you're sitting there going, I have no idea what my vitamin D level is, please go out and get your serum vitamin D level tested, because it is so critical to so many of the different functions in our body. And I cannot stress that enough. So thank you so much for tuning in today. You've been listening to Invite Health. I'm Dr. Amanda Williams. Stop by one of our Invite stores. Have a good day.